My biggest concern is the active role that our federal government wants to take in healthcare, and it may put me out of a job. That's my biggest concern.
The cost is going up constantly. Every year we get hit with renewals that are ridiculous. And as a job as a broker, we have to negotiate with the carriers, explain why the renewal should not have increased the way it did. And I think the groups depend on us to do that as a broker. I mean, they want us to know the industry, to know why things are the way we are, and what can we do to improve those.
I'm hopeful that the major focus is covering those that don't have coverage today. And I think Obama has mentioned his support of the current system for employers and covering those that are covered today. So I'm hopeful that the current system won't change, but will cover those that aren't covered today.
In a nutshell, I think the overall system, there needs to be reform in the system, but too much government involvement would be a bad thing.
I think the biggest issue we're facing right now is maintaining a private marketplace. We all know that healthcare needs reform and that the health marketplace, the health insurance marketplace needs reform right now, but we need to make sure there's a level playing field. Unfortunately, a public option is going to unlevel the playing field because the government will always be able to underpay providers. And unfortunately, by the time they figure out that underpaying providers doesn't work, it'll be too late. We'll be forced out of business. So I think that the biggest problem we face right now is making sure that we have a private reform and not just imposition of a public plan.
I have groups with 50 employees in Canada who buy voluntary supplemental insurance. They have to pay for it out of their own pocket. And when you go there, you find out that all of the employees buy this coverage. They demand it. We had to go out and find it. So anything that is a reflection of that system, I don't want to be a part of it.
The last thing we want to see as brokers, naturally, is universal health care. It doesn't work. It hasn't worked over in Europe or Canada or anywhere else. We play an intricate part in taking care of our clients and working hard for them, and I don't think we should be taken out of the role. I think it's important that we're part of the system.
I think brokers play a tremendous role. They lead people through the maze. They tell them what's the right product for their company. They look at the economics and they deliver a very good message to the client.
The broker adds so much value in the knowledge that they give their clients, the service, the satisfactory just answering daily questions. And if someone's not happy with the service that they're getting, they have the choice to go somewhere else to another broker who will get them that service. And with a public plan and public option that comes into play, you lose that. And I think for such a small percentage of premium that you get for that service, I think it's well worth it.
But I do worry about the role that brokers will play in healthcare. But I think we have a great role to play in terms of educating the general public in their choices about healthcare, particularly if things move towards consumer-directed healthcare, which they have been, because the consumers really need a lot of help with that.
If they mandate that, for example, everyone has to purchase health insurance, then what is the motivation for the carrier to use brokers as their sales force? They can just begin to go direct, just like auto insurance or other forms of insurance where consumers go direct to the carrier and carriers market directly to consumers. And you see that in states already, for example, Massachusetts, where they mandate individual health insurance and there's no broker market.
One of the things that most concerns me is, especially with Obama getting in office, some of the things he's wanted to do with national health care. I think that the broker community is still the best distribution for health care. I don't know of any other distribution channel where you're going to be able to reach everybody that you can, company-wise, from both small or large.
It's always going to be a role for brokers. I think it's always going to be a private payer system. I think no matter what kind of changes come down, I think there's always going to be a place for us to deliver health care to our employers and to the community. I think that I think it's a relationship business, and I don't think you can take the people out of this business.